Hey guys, this is Dr. Hub. Today we look at the classification and this is of the transplant rejection reactions. So to begin with, first is the hyperacute rejection. So under the hyperacute rejections, and this will occur from minutes to hours. So under this, first we look at the mechanism of action. So the mechanism is it is an anti-donor antibodies. There's anti-donor antibodies, and they are present in the circulation of the recipient. Present in the circulation of the recipient. Then comes, we look at the histopath examination. Histopath, there is a grossly, it is cyanotic, as well as it is mottled graft. There is mottled graft, and this is associated with this pale white areas, and there are also presence of the neutrophils accumulate. Also there is neutrophils which accumulate. And then looking at the acute fibrinoid necrosis of vessel walls or complete occlusion by the thrombi of the thrombi. Next we look at the acute rejection. So under acute rejection, this is from days to weeks. And the acute cellular rejection. So under acute cellular rejection, there is involvement of the acute T cell mediated rejection. So what is the mechanism of action? The mechanism is there is a CD8 plus CTLs. So what they do is they directly destroy the graft or the CD4. So they destroy the graft or the CD4 plus cells. So after the destruction of the CD4 cells, they secrete these cytokines. That damage the graft. So let's look at the histopath examination. Under the histopath findings, there is a tubulo-interstitial pattern. There is tubulo-interstitial pattern, that is type 1. So here there is a extensive interstitial and also the tubular. There is a extensive interstitial and the tubular inflammation. And this is associated with a focal tubular injury. Associated with focal tubular injury. And then comes the vascular pattern. So in the vascular pattern, there is inflammation, that is a type 2, and necrosis. Necrosis will be type 3. There is endothelitis. So the endothelitis is nothing but the swollen endothelial cells, and these cells are with the lymphocytes. So these cells are with the lymphocytes, and these lymphocytes are between the endothelium and the vessel wall. Next, we will look at the acute antibody mediated. The acute antibody mediated, and this will be the humoral rejection. So let's look at the mechanism. There is antibodies, and they bind to the endothelium. And what happens is they activate the complement. So they activate the complement, and this causes the damage and the graft failure. Now let's look at the histopath examination. There is inflammation, and this is of the glomeruli. Next, there is also the peritubular capillaries. Peritubular capillaries. Next comes the activation of the antibody dependent. The activation of the antibody. The activation of the antibody dependent, and this is a classical complement pathway. Classical complement pathway. Then there is also involvement of the focal thrombosis. There is involvement of the focal thrombosis, and this is in a small vessels. Then we look at the chronic rejection. So in terms of the chronic rejection, it occurs from months to years. The mechanism being, there are T cells and they react, and this is against the alloantigens, and they secrete cytokines. Cytokines are secreted, and what they do is they stimulate the fibroblast and the vascular smooth muscle cell. So that is nothing but the graft arteriosclerosis. Then the chronic rejection may also be antibody mediated. So it can also be the antibody mediated. Now let's look at the histopath findings. Under histopath, there is a predominantly vascular changes. And that includes the intimal thickening. There's intimal thickening and the vascular occlusions. Next, there is also the glomerulopathy. And this is with the duplication. The duplication of the basement membrane. Next, it includes the interstitial fibrosis as well as the tubular atrophy. This interstitial fibrosis, tubular atrophy, and this is with the loss of the renal parenchyma. So there is loss of the renal parenchyma.